Have you ever wondered if the blood pressure numbers your doctor tells you to hit are really meant for you, especially as you get older? What if the ideal reading isn't one universal number, but something that changes as we age? Today, we're diving into the truth about blood pressure in older adults, what numbers matter, why they matter, and how to truly protect your heart and brain as you age. The bottom number, diastolic pressure, measures the pressure when your heart relaxes between beats. For decades, doctors taught that the perfect blood pressure for adults was 120/80. But here, BS, where it gets interesting. That one-size-fits-all idea doesn't hold up when we look at seniors. As people age, the walls of their arteries naturally become stiffer. That's as a normal part of aging. Think of younger arteries like flexible garden hoses and older arteries like well-used ones that aren't as springy anymore. As those walls stiffen, the heart has to work a bit harder to pump blood, and that often nudges the systolic number upward, even in healthy older adults. So, does that automatically mean something is wrong? Not necessarily. Let's break it down with some real science. Multiple major studies involving tens of thousands of older adults have shown that aggressively forcing blood pressure down to ideal numbers like 120/80ths might not be beneficial, and in some cases could even be harmful. Older adults with systolic pressure in the low 120s sometimes experienced dizziness, falls, and reduced blood flow to vital organs because the heart wasn't able to maintain enough pressure. This was particularly true for people over 75. What researchers began to notice was that many seniors felt better, lived longer, and had fewer serious side effects when their target systolic pressure was a bit higher, often closer to 130 or even 140. But wait, before you think that hypertension isn't a problem for older adults, let's be clear, high blood pressure absolutely matters. Studies link elevated readings with higher risks of strokes, heart attacks, and cognitive decline. That's a fact. The key is understanding how high is too high for someone in their 70s, 80s, or 90s. When blood pressure climbs above 150 systolic or 90 diastolic, the risk starts rising steeply. That's where treatment, be it lifestyle changes or medications, really matters. It gets even more nuanced. Individuals vary tremendously. A physically active 70-year-old marathon walker might have different needs than someone with diabetes or chronic kidney disease. Genetics, diet, stress levels, they all influence blood pressure and how the body responds. So, while guidelines give us a framework, the best care for an older adult is personalized care. Another piece of this puzzle is how we measure blood pressure. Most readings happen in a doctor's office, where anxiety and clinical settings can spike numbers artificially, a phenomenon called white coat hypertension. Conversely, some seniors have masked hypertension where their readings look normal in the clinic but are elevated at home. That's why many doctors now recommend home blood pressure monitoring. It gives a more accurate picture of what's happening day to day. And now let us tackle a question many people know the answer to. What exactly is the ideal range for older adults? Recent guidelines suggest aiming for systolic blood pressure around 130 to 140 for many people over 65. As long as they're comfortable and not experiencing symptoms like dizziness or fatigue, diastolic pressure. The bottom number is usually safest when it stays above 60. Because if it dips too low, the heart and organs might not get enough blood flow. But here is something even more important than numbers. Focus on healthy habits that naturally support good blood pressure. Things like maintaining a balanced diet, rich in fruits, vegetables, and whole grains. Staying physically active in ways you enjoy, managing stress through mindfulness or social connection, and getting enough sleep each night. These habits aren't just numbers on a chart. They improve overall resilience, reduce inflammation, and support brain health too. Part 2 of this story begins with a perspective shift. Instead of asking, "What should my numbers be?" many experts now encourage seniors to ask, "How do I feel? Am I steady on my feet? Am I getting dizzy when I stand up? Am I tired all the time?" Because here's the truth. Blood pressure that looks perfect on paper, but makes you lightheaded or prone to falls is not ideal at all, especially as we get older. Some blood pressure medications, while extremely effective at protecting the heart and brain, can cause blood pressure to drop too quickly when standing. For older adults, that can lead to dangerous falls, hip fractures, and hospital visits. And surprisingly, those complications can be more life-altering than the high blood pressure itself. This brings us to an important concept called individualized targets. Instead of trying to force every older adult into the same numbers, doctors now look at the person, their health history, medications, mobility, brain health, and what their day-to-day life looks like. For example, take 2 seniors. One is active, exercises regularly, eats well, and has no major chronic illnesses. Another struggles with balance issues, occasional dizziness, and takes several medications that already affect blood pressure. Even if they are the exact same age, their ideal blood pressure target may not be identical. And then there's the brain. Many people don't realize how closely blood pressure is tied to cognitive health. High blood pressure over many years can damage tiny blood vessels in the brain, increasing the risk of vascular dementia and even accelerating memory loss. But here's where it gets complicated. If blood pressure is pushed too low in older adults, the brain may not get enough oxygen-rich blood, and that too can affect cognitive function. It's a delicate balance, a seesaw where extremes on either side can be harmful. Let's go even deeper. How does lifestyle influence blood pressure in seniors? In many surprising ways. Sodium, often blamed for high blood pressure, definitely plays a role, but not everyone is equally sensitive to it. Some people can enjoy moderately salty foods without major changes, while others see their numbers jump significantly. Then there's potassium, a mineral found in bananas, beans, and leafy greens, which helps relax blood vessels and balance sodium's effects. Most older adults don't get enough of it. Fiber-rich foods, healthy fats like olive oil, regular hydration, and reduced processed foods all support healthier arteries and better blood flow. Movement matters too, and no, it doesn't have to look like running marathons. Walking, swimming, chair exercises, Tai Chi gardening all help keep blood vessels flexible, reduce stress hormones, and improve overall circulation. It's incredible how even 20 to 30 minutes of gentle movement a day can create noticeable differences over time. And speaking of stress, emotional health is deeply connected to blood pressure as well. Loneliness, anxiety, grief. These emotions can elevate stress hormones that tighten blood vessels and raise pressure. Social interaction, hobbies, family time, and relaxation techniques aren't just nice extras, they are part of cardiovascular health. Another factor that often gets overlooked is sleep. Poor sleep, sleep apnea, or irregular sleep patterns can raise blood pressure significantly and put extra strain on the heart. Many seniors realize they have sleep apnea because it doesn't. T always present as loud snoring. Sometimes it's just daytime fatigue or waking up often during the night. When treated, both energy levels and blood pressure often improve dramatically. Also important is medication awareness. Seniors are often prescribed multiple medications, sometimes for blood pressure, sometimes for other conditions. But certain drug combinations can interact, either raising or lowering blood pressure unintentionally. That's why periodic medication reviews with a doctor or pharmacist are so valuable. Adjusting doses or removing unnecessary medications can make a huge difference in comfort, stability, and blood pressure control. A key takeaway here is this. The ideal blood pressure for older adults is a range, not a single perfect number carved in stone, for many healthy seniors. A systolic reading somewhere around the 130s is often considered appropriate, not too low, not too high, just enough to protect the heart and brain while maintaining energy and balance. But ultimately, the best number is the one that supports a long, active, steady, and fulfilling life without debilitating side effects. Now, let us explore one of the most misunderstood issues around senior blood pressure: the difference between managing numbers and optimizing health. For most older adults, the goal is not just to hit a specific systolic or diastolic reading. The goal is to keep the heart strong, the brain sharp, and the body stable. That's why more cardiologists and geriatric specialists are moving toward what they call functional outcomes. In simple terms, they ask, is the patient able to stay active, think clearly, avoid dizziness and falls, sleep well, enjoy daily life? Because blood pressure is just one piece of a much bigger puzzle of aging well. This brings us back to the central question. So what is the ideal blood pressure for seniors? The truthful answer is that it depends, but science has given us some useful guideposts for many adults over 65. Keeping systolic pressure around the 130s often provides protection without excessive side effects. But for some in their 70s and 80s, especially those who are frail or prone to dizziness, staying in the 140s might actually be safer, and in almost all cases, preventing spikes above 150/90 is important. Because that's where risks for stroke, heart disease, and cognitive decline increase significantly. Meanwhile, keeping the diastolic number above 60 helps ensure that blood flow to vital organs remains steady. These numbers aren't opinions, they're based on years of clinical trials, observational studies, and real-world clinical experience from experts in aging. It's also worth noting that the medical community doesn't always agree on a single target, and that SOK guidelines evolve as new research emerges. Some studies have shown benefits to tighter control for certain older adults, especially those with diabetes or kidney disease. Other research suggests that too tight control in very elderly patients may cause more harm than good. The reason these findings seem conflicting is because seniors are not a uniform group, an 80-year-old who is independent, and biking daily is not the same as an 80-year-old with balance issues, chronic illness, or cognitive decline. That's why the phrase, treat the patient, not the number, is becoming more popular among clinicians.